have labral tears, I have cam pincer impingements. I just have to work around that, and I have to really pay attention to my body. People get caught up in these normal ranges of motion, but like you really don't need a ton of rotation at the joint to be functional. Strength isn't everything for health. Flexibility isn't everything for health. You need this healthy balance of the two for your joints to function well and your tendons and connective tissues to be healthy.
In today's video, I'm sitting down with Dr. Garrett G. Money, physical therapist with hip impingement and labral tears, and we're talking about some practical advice that you can use if you are an athlete with hip impingement or FAI bone shapes. If you've got hip pain, you're going to want to hear what he has to say. We're going to talk about stretching. We're going to talk about the muscles you need to target when you're stretching and strengthening things. We're going to talk about some mistakes people make, what to do when surgery fails, and we're also going to talk about the real limits of the FAI bone shapes like cam and pincer impingement and what they might have to do with flexibility. So if you're ready, let's get ready to think right, move right, and feel. That's a good one. Feel right. Okay, so let's talk about some practical things that somebody with hip impingement, these supposedly bad bone shapes, can do. You're somebody who's gone through it, you're now a PT, what are some practical steps that can help?
Yeah, I would say, first of all, be very patient with the process. Like, you're not going to get things right the first time. As soon as you start doing exercises for your hips, maybe you flare some things up.
Right.
You start to understand like what your body is responding positively and negatively to. And I would just say, in terms of practical things that work for me in terms of what my hips responded well to, I would say a lot of strengthening of some muscles that aren't typically isolated in traditional strength and conditioning programs.
For example?
For example, we go to the gym, we're strengthening our glutes, our quads, we're doing squats, leg press. Even the long range of the hamstrings, hinge variations, RDLs, all good stuff. But some other muscles that really help with, centration of the hip joint, just don't get exposed to a lot of load, like the hip flexors, the adductors, even the more proximal hamstrings that help control the tilt of the pelvis, and even different trunk musculature. It's really eye-opening how much muscles of the torso will pull the hips in a certain place or keep you rotated to one side. I mean, muscle we work on a lot is the obliques.
Yep.
So, and of course, with more compound exercises, squatting, deadlifting, yes, you're working the hip flexors, yes, your obliques are co-contracting to maintain spinal stability, but we're not working them through their full range of motion and building some flexibility and strength there. And, we talk about the adductors a lot as well. Like, they have so many different functions.
Right.
Especially controlling hip rotation. And a lot of people with FAI are limited in hip rotation. And sometimes, at first, they can't go after hip rotation directly because it's painful, it's pinchy, things are flared up. So we have to do so in a way that isn't causing excess pain. So I would say practical advice with flexibility work. You could still work on your flexibility, but try to find positions that aren't flaring up the hip. So people say like, oh, if you have a bone morphology that's not suitable for a hip to rotate and flex, stay away from that completely. But the problem is that's not teaching you how to build tolerance in those compressed positions.
Right. I think like the mythology there is like, if you go there, you're going to destroy your hip.
Yeah.
Right.
You're creating more damage.
Right.
But we know that's not actually true. So I would definitely encourage finding ways to work on that rotation. Maybe it's not directly, because like I said, like more superficial muscles that aren't even like super close to the joint, maybe they cross the joint, they can control rotation too. Like it's amazing how just, loosening, the hip flexors, the adductors, the glutes, all that stuff will help your rotation in general, just the more space you have in the hip, and then maybe you're in a better place to work directly on the hip rotation at the joint level, doing more joint capsular stretches and things like that.
So it's like, you've worked so hard in the gym to build up all these bigger muscles that you see in the mirror that might be useful for producing a big amount of force, but that might also limit your ability to create any rotation in a way that's comfortable. It could be compressing, it could be just completely limiting the range, and the muscles that want to create rotation can't, and then they're painful or they're too weak to even do anything.
Exactly. So I would call this, a limitation in joint variability. You know, all it knows how to do is move through this range of motion that you're doing in compound lifts, and like the heavier you lift and the more you push for high performance, this reduces your joint variability, you know. Like the heavier you lift, the more, you know, you want to be more stable, and your body isn't going to want to express more ranges of motion. But then when you try to go and do more human-like activities, you know, rock climbing, tie your shoes, you know, sit cross-legged, it's like, now this requires more joint variability, you know? This is the thing, it's like, strength isn't everything for health. Flexibility isn't everything for health. You need this healthy balance of the two for your joints to function well, and your tendons and connective tissues to be healthy.
So then when you're looking at this whole picture, you know, you've now gone through physical therapy school, you've been a practicing physical therapist. What do you think about this whole idea of these bad bone shapes of FAI and what it actually means for people, and what even these bad bone shapes are?
Yeah, and it's tough to even say they're bad, per se. I mean, I would just say the bone shapes you have were probably a strategic element of your biology. You know, it's laying down this bone for a reason. You know, if you came up in, you know, as an athlete doing cutting sports, all this shifting around in the joints, your bones are responding to that just as your muscles do to load. So like when we go in the gym, we strength train, we create all this mechanical tension, we grow back stronger, your body responds by laying down more muscle. Your bones do the same thing. You know, if there's a lot of impact in a day-to-day, you know, in a sports specific way, a lot of load going through those bones, it's going to respond by laying down more bone to restrict that direction. So this is a positive adaptation, we could say, you know? So what happens when we go in and we try to shave down these bony overgrowths, we'll say. Overgrowths, yeah, sure. We probably significantly reduce stability in the hip. And people might think, oh, but yeah, whatever, if I have a little bit less stability, I'll have more range of motion, therefore I won't be in so much pain. Well, that's not the only population we see who has FAI. Yes, we see the stiff guy who can't move through range of motion, but we also see the dancer with hypermobility, with lack of that stability in the joint, who can demonstrate a lot of passive range of motion, yet they still have hips that feel terrible. And they have labrum tears. So, you know, we can't directly correlate, you know, lack of range of motion with pain. So in terms of what I think about impingement in that term in general, I don't think it's very accurate, because we impinge on our joint structures on a day-to-day basis. You know, I'm impinging right now. My shin is impinging, you know, on, like, we're moving through these compressed positions. It doesn't mean we're always going to have pain. So impingement isn't a bad position. And then you'll see exercises that get debunked, or on YouTube they get bashed, like an upright row. This puts your shoulder in an impinged position, so therefore it's a terrible exercise. I don't care if it puts me in an impinged position. Doesn't mean I have to have pain there. And in fact, I would actually want to build tolerance to impinged position over time.
Safely, right? Gradually understanding what muscles should be working to make it feel fine.
Yes. If I already have shoulder pain, I'm not just going to do a bunch of upright rows and just already piss off a flared up shoulder, because we are moving into these impinged ranges that are already apprehensive and painful. So, you know, to sum up, I would say added bone growth is a strategic element of your biology based on your activity you're doing. And now all it means is that, you know, your bones are more so structured for that stability now. And they're not going to be as structured for demonstrating large ranges of motion. And that's just the reality of it.
Unless you optimize the muscles to figure out how to allow for it.
Correct. But that's the thing. It's like you can have these bony morphology changes that don't allow for large ranges of motion, and you just might reach bony collisions a little bit earlier. But if you strengthen the muscles, build flexibility around the muscles superficially to the joint, it might not even be an issue at all. There's plenty of people I know who have, you know, labrum tears on imaging, bony morphology changes, cam impingements, pincer impingements. They could squat just fine. They could sit in a deep squat. They can do Cossack squats. They can do pistol squats.
Right. And also, like you were saying earlier, there are very flexible dancers, yoga practitioners who have the bone shapes, and it does not create any range of motion problem.
Yeah.
But they still have pain because they can't control those, much of their range of motion, right?
Right. And a joint does dictate how a muscle will move, but then also vice versa. The muscle will dictate how a joint is situated, how the femur is sitting in the acetabulum, within the acetabulum. So they go hand in hand for sure.
Right.
And I think we can't just go off of an image, an MRI, an X-ray to say, okay, I'm never going to be able to demonstrate this range of motion because of what my X-ray says.
Right. So then also we've talked about the surgery, and you mentioned like, hey, you're out also cutting into the muscle.
Yeah.
Right. And joint capsule. So we speak a little bit about that.
Yeah. So it's a very invasive surgery. You know, the arthroscopic surgery for FAI. You're cutting into your glute tissue. You're cutting into your joint capsule. Your joint capsule is made for stability and checking range of motion. And you know, this is the thing. It's like athletes, they get this surgery because they're flared up in the hip. You know, they've obviously exceeded their ability to recover in whatever task they're doing. And, you know, and instead of backing off a little bit, getting an assessment, understanding where they're limited in strength, range of motion, all that thing, you know, and working on that, they decide, okay, I'm going to get an X-ray because it's a quick answer. Mm-hmm. You know, I can see what's going on in my hip. A surgeon can give me a definitive, okay, it's going to be a 3-month timeline, and then you could start getting back to sport-specific things. Like, they have specific timelines. That's why they opt for the surgery right away in terms of athletics. But what we'll see, you know, is there is a temporary reduction in pain after the surgery because, oh, I just stopped doing the activity that was bothering my hip in the first place.
Yep.
And then over the course of months and years, sometimes their pain comes back even worse.
Yeah, I've seen so many stories of people saying, I got the surgery, I'm worse off now than I was before.
Yeah.
And they said, I just have to wait longer and it'll get better. But it's not, you know, it's been 2 years and it's not getting better.
Mm-hmm.
Right.
But then what's more confusing about that is, like, sometimes it'll feel better, like, after the surgery.
Mm-hmm.
But then, like, later on, it's
that's
like things have come back and they've gotten worse because now you've returned back to activity. You've done some of the activity that was causing the pain in the first place, and you still haven't fixed the original issue, because the bone grew there for a reason, because there was excess shifting in the joint, because maybe you didn't have the space in the hip, maybe your muscles couldn't experience eccentric length, you know, your muscles couldn't elongate, you didn't have the stability in the joint, your muscles around the joint were weak. So there was causing that excess collision in the bones, and that's probably what was growing the bone in the first place. So I think it's important to look at all these factors and not just go off the image and call this, okay, this is bad bone shape. And yeah, your bones are going to be at this, like I said, disadvantageous position to demonstrate range of motion, but that doesn't mean you can't display these large ranges of motion if you work on it. You just have to work on it, but just be careful with it, you know? You just have to work around your structure.
Right. So for you, you've gone through that process, and we've talked about that earlier. And so for you, the bone structure hasn't truly limited you. It's made you have to train carefully.
Yes.
Made you have to make some adaptations and then gradually change your positions and work towards it. But it hasn't said, Garrett can't squat because of bone shapes.
I have labral tears. I have cam pincer impingements. Mm-hmm. I just have to work around that, and I have to really pay attention to my body. Mm-hmm. You know, like, am I doing too much? Am I recovering? Because my body will tell me immediately of whether I'm doing too much.
I guess one question I would have is would that be any different from somebody without the bone shapes?
It really isn't. Okay. You know, I mean, like I said, you're just at a more disadvantageous position. You know, say somebody who didn't have an athletic background, they didn't have this genetic predisposition for hip arthritis and whatnot. You know, them doing this is just easy. Mm-hmm. You know, for me, this used to be very painful, but now I could do this. I could compress my knee toward my chest. Mm-hmm. Yes, there's a little lumbar flexion assisting that, but still. before that was extremely painful. So I just had to build tolerance to this. I had to increase my ability for my glutes, my proximal hamstrings to, elongate a bit, improve strength of my hip flexors to create that stability in the joint. But, like sometimes bringing it across my body in max internal rotation, like I'll probably never have a textbook range of motion internal rotation, 45 degrees,
We'll see. I'll push back on that.
Maybe,
just say,
like
given how you train, I bet you'll find a way. I bet
possibly,
you'll find
but
a way.
also like I don't need it.
Right.
I think people get caught up in these normal ranges of motion, but like you really don't need a ton of rotation at the joint to be functional. I will say, like, I started off with 0 degrees on this right hip. Now I have about, like 25 degrees of internal rotation. I can rotate it.
Yeah.
That's much better than nothing. It's not the normal range of motion at the hip.
Right.
It's not a normal 40 degrees of internal rotation. Maybe I get by with a little bit more external rotation because that's how my hip morphology is. Maybe I have a little bit more of a retroverted hip.
Okay.
I still have those bony changes in my hips, which who knows, could have gotten worse or better since the last time we checked on them.
Right.
I have no idea. All I know is I'm in a much better place than I was.
Yeah, and you have so much more range because you've been working at it
Yeah.
safely.
Yeah.
So I guess one more question is, those people out there who are going through this, they're feeling like, I don't know if there's hope, feeling down for justifiable reasons because they're hearing that there's not much hope. What kind of steps can they take to know that they're moving in the right direction?
Yeah, I mean, I can't even say, like, just be patient because it's really important. It's really difficult to have that patience when there's so many unknowns. It's like, who do I listen to? I have people saying, oh, don't get the surgery. People saying, oh, yeah, you're going to need the surgery. It's very tough because then once you start to flare something up, then you're like, okay, I'm definitely doing things wrong. I need to jump to a surgery or try another method. So I think it's really important to have a support system that has been through this before, it doesn't have to be a medical practitioner, reach out to people who have been through the process, who have FAI, who have made significant improvements in their function, day-to-day life, but also can display some cool ranges of motion that you want to do,
Right.
I think people don't notice their FAI symptoms until they want to do fun things that require, larger ranges of motion, like they get into Olympic weightlifting or they get into rock climbing or something where your limbs have to rotate and flex,
I think, that's definitely a common story. Although I would say, like, your story with soccer, right?
Yeah.
So, like, when you overdo something so much and never work on your range of motion, then the daily ranges of motion become a problem. That's that's your story, right? Like, getting in and out of the car is like, ugh.
Exactly, yeah.
Well, thank you for all these insights. And if you have any extra questions, please drop them in the comment section.
Please.
I hope you found this video helpful, and if you have more questions, be sure to drop those questions in the comment section down below. And I encourage you, if you're an athlete with hip pain, to go to Dr. Garrett's website and get in touch with him, especially if you're looking for coaching to help you on an individual basis. Also, check out his YouTube channel. He's got some great content, great ideas for helping you build stronger, more mobile hips while still being an athletic beast. If you have hip pain and you're looking for more ideas to help you get out of this hip pain, go to uprighthealth.com/FAI and you'll find details on the Healthy Hips program, which is a program I've made to help you rebuild your hips at home. If you haven't seen part 1 of my interview with Dr. Garrett, where he talks about his background with hip impingement and how he ended up figuring out how to fix his body, I do encourage you to check it out. I will leave a link in the description box down below. And also, if you like learning by listening, then you can listen to the full interview on the Upright Health podcast. Make sure to check for the link in the description box so you can subscribe. It's on Spotify and whatever, Apple, blah, blah, blah. Just subscribe, follow it wherever you are, and look out for the full interview with Garrett about hip impingement. If you learned something from this video or it blew your mind in some way, drop me a comment down below to let me know what you learned. And if you want to support this channel, hit the join or thanks buttons on YouTube or go to uprighthealth.com/donate to find all the easy options to support content like this. More free videos to help you with your hips are right here. Like, share, and subscribe. And as always, I hope you remember that pain sucks. Life shouldn't.